Hello guys, welcome back to my channel. In this video, let's see about gout. Gout is a common type of arthritis that causes intense pain, swelling and stiffness in a joint. It usually affects the joint in the big toe. Gout attacks can come on quickly and keep returning over time, slowly harming the tissues in the region of the inflammation, and can be extremely painful. There are times when symptoms get worse, known as flares, and times when there are no symptoms, known as remission. Repeated bouts of gout can lead to gouty arthritis, a worsening form of arthritis. It is the most common form of inflammatory arthritis in men, and although it is more likely to affect men, women become more susceptible to it after the menopause. An excess of uric acid in the blood brings on gout. Uric acid comes from two places, produced by the body and from the diet. Uric acid is produced in the body during the breakdown of purines, the chemical compounds that are found in high amounts in certain foods such as meat, poultry and seafood. Any extra uric acid usually filters through the kidneys and gets passed in urine. If the body produces too much uric acid or fails to excrete it in the urine, crystals of monosodium urate form in the joints and tendons. These crystals cause intense inflammation leading to pain, swelling and redness. The most common factor that increases your chance of gout and gout attacks is excessive consumption of alcohol, especially beer. Repeat attacks of gouts are common if the body's uric acid level is not kept under control. Symptoms of gout. The signs and symptoms of gout almost always occur suddenly and often at night, and those include intense joint pain. Gout usually affects the large joint of your big toe, but it can occur in any joint. Other commonly affected joints include ankles, knees, elbows, wrists and fingers. The pain is likely to be most severe within the first 4 hours to 12 hours after it begins. Lingering discomfort. After the most severe pain subsides, some joint discomfort may last from a few days to a few weeks. Later attacks are likely to last longer and affect more joints. Inflammation and redness. The affected joint or joints become swollen, tender, warm and red. Limited range of motion. As gout progresses, you may not be able to move your joints normally. Risk factors of gout. You are more likely to develop gout if you have high levels of uric acid in your body. Factors that increase the uric acid level in your body include diet. Eating a diet rich in meat and seafood and drinking beverages sweetened with fruit sugar increases your levels of uric acid, which increases your risk of gout. Alcohol consumption, especially beer, also increases the risk of gout. Obesity. If you are overweight, your body produces more uric acid and your kidneys have more difficult time eliminating uric acid. Medical conditions. Certain diseases and conditions increase your risk of gout. These include untreated high blood pressure and chronic conditions such as diabetes, metabolic syndrome, and heart and kidney diseases. Certain medications. The use of thiazide diuretics, commonly used to treat hypertension, and the low-dose aspirin also increases the uric acid levels. Family history of gout. If other members of your family have gout, you are more likely to develop the disease. Age and gender. Gout occurs more often in men, primarily because women tend to have lower uric acid levels. But after menopause, women's uric acid levels approach those of men. Men are more likely to develop gout earlier, usually between the ages of 30s and 50s. Whereas women generally develop signs and symptoms after menopause. Recent surgery or trauma. Experiencing recent surgery or trauma has been associated with increased risk of developing a gout attack. Complications. People with gout can develop more severe conditions such as recurrent gout. Some people may never experience gout signs and symptoms again. Others may experience gout several times each year. Medications may help to prevent gout attacks in people with recurrent gout. But if left untreated, gout can cause erosion and destruction of a joint. Advanced gout. Untreated gout may cause deposits of urate crystals to form under the skin in nodules called tophi. Tophi can develop in several areas such as your fingers, hands, feet, elbow and Achilles tendon along the back of your ankles. Tophi usually aren't painful, but they can become swollen and tender during the gout attacks. Kidney stones. Urate crystals may collect in the urinary tract of people with gout, causing kidney stones. Medications can help to reduce the risk of kidney stones. Prevention. During symptom-free periods, these dietary guidelines may help you to protect against future gout attacks. Drink plenty of fluids. Stay well hydrated, including plenty of water. Limit how many sweetened beverages you drink, especially those sweetened with high fructose corn syrup. Limit or avoid alcohol. Recent evidence suggests that beer may be particularly likely to increase the risk of gout symptoms, especially in men. Get your protein from low-fat dairy products. Low-fat dairy products may actually be a protective effect against gout. So these are your best protein sources. Limit your intake of meat, fish and poultry. A small amount may be tolerable, but pay close attention to what types and how much seem to cause problem for you. Maintain a desirable body weight. Choose portions that allow you to maintain a healthy weight. Losing weight may decrease uric acid levels in your body, but avoid fasting or rapid weight loss, since doing that may temporarily raise your uric acid levels. Diagnosis of gout. Tests to help diagnose gout may include joint fluid test. Your doctor may use a needle to draw fluid from your affected joint. Urate crystals may be visible when the fluid is examined under a microscope. Blood test. Your doctor may recommend a blood test to measure the levels of uric acid and creatinine in your blood. Blood test results can be misleading, though some people have high uric acid levels but never experience gout. And some people have signs and symptoms of gout but do not have unusual levels of uric acid in their blood. X-ray imaging. Joint X-rays can be helpful to rule out other causes of joint inflammation. Ultrasound. Musculoskeletal ultrasound can detect the urate crystals in the joint or in a tophi. Dual energy CT scan. This type of imaging can detect the presence of urate crystals in a joint even when it is not acutely inflamed. This test is not used routinely in the clinical practice due to the expense and is not widely available. Treatment. Gout patients often have acute inflammation around their joints. The majority of gout cases are treated with medication. Medication can be used to treat the symptoms of gout attacks, prevent future flares, and reduce the risk of gout complications such as kidney stones and development of tophi. Commonly used medications include non-steroidal anti-inflammatory drugs, colchicine, and corticosteroids. These reduce inflammation and pain in the areas affected by gout and are usually taken orally. Medications can also be used to either reduce the production of uric acid or improve the kidney's ability to remove the uric acid from the body. Without treatment, an acute gout attack will be at its worst between 12 and 24 hours after it began. A person can expect to recover within 1 to 2 weeks without treatment, but there may be significant pain during this period. Thank you for watching. Hope you guys like this video. And please do like, share and subscribe.